Thank you. I'm Mike. I'm a consultant psychiatrist and the clinical director of the Clinical Research Unit for Anxiety and Depression at St Vincent's in Sydney. So I thought I'd start today, as there's been much of the theme, with a bit of a patient story. So this is some feedback that we received from one of our service users not very long ago, who we've called Margaret. And she's living in inner regional Victoria, and she's about 48 years old. So she wrote to us, "My husband left me after many years with no notice. It would take me 5 weeks before I could speak with a psychologist. The GAD, or the worry course, helped me through a very dark time in my life. When there was no one to help me except the grief line, this course was my go-to resource for getting through one day at a time." So for all of us, there's a little bit of Margaret's story in all of us. We've all been through difficult times in our lives, and for those of us who have been brave enough to reach out for help for either yourselves or perhaps a loved one, sometimes it can be tough. We know that we live in a world of waiting lists, and I have to say in my experience that 5 weeks to get into a psychologist at the moment is actually remarkable, especially in a regional area in Australia. It's much longer than that. And this is particularly important because we know that 50% of Australians will suffer from a significant mental health difficulty at some time in their life. So let me introduce you to This Way Up. So This Way Up is a web-based online digital mental health service where we teach you practical tools to help you take care of your mental health. And as I mentioned, it's important because up to one in 2 Australians will go through a significant mental health difficulty. Another shocking statistic around that is it usually takes about, on average, 8.2 years of someone living with symptoms before they reach out for help. And it's really only 50% of people who actually access any help at all. So 50% of people, and that's in a system that's already stretched and at crisis. So this was not used to us, and I'd like to tell you a little bit about our journey that's led us here today. So our story actually started in 1983, where we were a busy face-to-face clinic at St Vincent's Hospital, and we were treating people with something called cognitive behavioural therapy. We initially started to treat them individually, and then we thought, how else can we teach people to do this? So then we moved to groups, and we still had a very long waiting list. In the year 2000, along comes this thing called the internet, and the department thought, what can we do to be able to harness this technology to be able to take what we know works, and we measured it, so we knew that it works, and be able to make it more accessible to more people. So it was actually in 2001 when we launched our service called Climate, and it was a very Australian name because it stood for the clinician's mate. But back in 2001, of course, we didn't realise that climate and change would become something very different. So in 2011, it was rebranded as This Way Up, and that's when we from our current form. So we stuck with being a mental health service until 2016, when we started to work with our chronic pain team at the hospital. And then we produced what was probably one of its first in kind, a true multidisciplinary online program to help treat chronic pain. And I'll come back to that a little bit later. And then, of course, I think the key word today has been pivot, and that's 2020 when COVID came along. And we were able to instantly be able to support people who are struggling at home, who had been tested positive for COVID for a start and experiencing anxiety and distress. And then, as I'll show you later, what happened in the general community in terms of being an online platform. Okay, so This Way Up is really all about overcoming barriers and increasing access to evidence-based treatment. So there's no referrals, there's no waiting times. We're a service that's ready when you are. And of course, we're also low or no cost, and that includes no hidden costs, like the cost it takes to go and see a free clinic. So there's a hidden cost in that, where you have to take half your day off work, and then you have to travel in. So there's hidden costs that are in free treatment as well. So we're the largest provider of mental health online courses. We have 18 different courses. They're all based on cognitive behavioural therapy. We have 4 wellbeing courses, which help people with common difficulties such as insomnia, coping with stress, and mindfulness. We have 9 disorder-specific courses, so they're things like anxiety, depression, OCD, and social anxiety, and there's a whole range of disorder-specific courses. And then we have what we call trans-diagnostic courses, and those are designed to treat conditions that generally run together, like our mixed anxiety and depression course, which is our most popular course. And that fits because mixed anxiety and depression is probably the most common thing that we see in the community. Each of our courses is based on an illustrated storyline. So you follow the story of characters who have symptoms just like you. And through the modules, you see what they do to be able to learn the skills to manage their recovery. And then, as with face-to-face treatment with cognitive behavioural therapy, it's all about you learn the skills, and then the real magic happens when you take the skills and you apply them to your real life. So it's exactly the same as seeing someone face-to-face. The system, of course, has built-in alerts and measures. So before each of the modules, people have to complete a series of outcome measures, which is consistent with a lot of the things that we're talking about today. They are able to see that as a progress tracker. If they're linked with a clinician, the clinician is able to follow their progress through the course. And of course, if they're deteriorating or if they trigger one of the alerts, both the patient and the clinician get alerted to that fact. So we're talking about value-based healthcare, so how do we fit into the system? So we fit into the system in a lot of different ways. And the first thing I'd probably have to say is we're all about flexibility and choice. So that graph that's on the right-hand, that little chart that's on the right-hand side, that's actually from the Productivity Commission's report. We're in Chapter 6, and we're proud to provide them the data for this chart that showed that just about 50% of our users access our service outside office hours. So there's a real need for flexibility around accessing care. Our courses are used in a variety of different ways to support clinical care. So you're able to use our courses while you're on a wait list. So rather than people not accessing any care, people are able to access a treatment that we know actually works while they're waiting to get in to see something more intensive. So the course teaches you about the condition, the course teaches you skills, it teaches you the language of therapy. It can actually speed up the whole process. Another fantastic way that our courses are used are as blended and complementing face-to-face therapy. So we have 23,000 clinicians that are using our courses, and I was going to say that a bit later, but the way that they integrate that into their practice is often that we know that clinician time is valuable. So a lot of clinicians see their patients and then they'll say, why don't you do this online course as well? So then they know that in between their sessions, the computer is teaching them the skills and they can use their clinical time to be able to help to apply them. So that's making much better uses of what is a scarce resource. So patients are happy because we know that patients, certainly when I teach the medical students, we talk about that once the patient leaves your consultation, they don't remember very much of what you talked about. They remember 20% of what was in the consultation. So we know that people are able to go home and revise the content and be able to reflect on it, and it helps them actually to be able to apply it to their life. We, of course, know as well that the courses are valuable as a standalone intervention too. So for a lot of people, doing an online course is enough, and I'll talk a little bit about that in a minute. So there's multiple ways that we can structurally support the healthcare system. Why do people choose this way up? So why would you do one of our courses? And one of the amazing things about this service is the fact that when we say something works, we actually know it does. And as a department, we've done 38 randomised controlled trials on our products to be able to say that they actually work. We also have published effectiveness data, so much the same as with medications. So we'll look at the system, it tells us if it's working, it's live, and then we'll publish data saying that, look, we've had 3,000 participants that have gone through in the community. This is what's actually been happening on the back end. So we're very public about the way that the courses work. And as it says there, 100% of the people who use our courses complete standardised measures. So these are the typical standardised measures that are collected multiple times throughout the course. And for the majority of users, there's we very nicely track down the results. And in terms of, well, what are the results? Oh, well, I was going to say, the one thing I was going to say was that in terms of the research, is that the research says that the courses are just as effective as seeing someone face-to-face. Now, every time I say that, it breaks my heart because I'm a clinician. And jumping from that then, what's the difference with an online course and seeing someone face-to-face? And it's really demonstrated by this graph. So we know when someone's doing an online course that we know what's in the box, we know what the person is learning, and we know how they're progressing. So we see that nicely with the system that's collecting the data. So here on this graph, it takes you our registrations up until the lockdown that we had in March. And you can see there's not many services that can say that we actually had a 1,000% increase in our course registrations over the period of the lockdown. Like, that's an extraordinary response for a scalable intervention. This then, following the lockdown, has continued on to be a 600% increase in demand. So the real pivot cultural shift that we've seen with the difficulties that people have had in terms of physical distancing. I was so pleased earlier today to hear someone say that virtual care is not just about telehealth, because it's also about integrating digital interventions into clinical care. We have just, I think, about hit our 110,000th patient who signed up for one of our courses. And as I mentioned before, it's a community of 23,000 clinicians who are actively integrating digital tools into their clinical practice. So an example that I was going to give you, I talked about a little about chronic pain. It's interesting that we heard about how expensive and how awful it is for people who are living with chronic pain and the importance of a multidisciplinary approach earlier today. So this is a collaboration that we've been particularly proud of. And this is just a little bit of an example with one of our partners. It was Sunshine Coast Persistent Pain Service who integrated our program into their wait list. And over 8 months, their wait list was actually halved. So they had half the number of people who were waiting to access the multidisciplinary care. So that meant that 50% of people got what they needed from the online course. And for those people who were still on the waiting list, they were able to receive care 30% faster. So I think that that really demonstrates the power of these online interventions. So, as I mentioned before, This Way Up is about clinical outcomes. We know that 80% of people who do one of our courses get significant improvement in their symptoms. We also know that in the clinical trials, 50% of people will no longer qualify for the diagnosis that they started the course with. So that's quite a very powerful intervention. Okay, so I was going to say that This Way Up is all about integrating and collaborating into clinical care. We've integrated into the PHNs, into the LHDs, and we have multiple international collaborators. One of the collaborations we're particularly proud of is that we've partnered with New Zealand's largest NGO, the WISE Group, and our service is actually being provided in New Zealand under the badge of Just a Thought. And it was launched about 2 years ago by Jacinta with much fanfare, which was very exciting. I mention them because we're about to publish a paper that compares our COVID experience, and in terms, they're a much younger service than we were, but during the period of New Zealand's lockdown, they went from 1,000 registrations a month to 1,000 registrations a week. Again, that shows the power of digital interventions and the big shift that we're seeing. We have French translations that are actively being used in Quebec. We have partners at UCLA and we have partners in Harvard and Partners Healthcare who are providing our courses across Boston. My question to you today is, if your service isn't integrating digital tools into clinical practice, why not? And I guess I leave you with this final challenge, really, to go to our website, to log in, to learn something, and please try and live it. So thank you.